Good morning, everyone. I'm Adrian Dix. I'm BC's Minister of Health. I want to acknowledge that we're gathered here today on the traditional, ancestral, and shared territories of the Katzie, of the Kwantlen, of the Semiahmoo, and the Tsawwassen First Nations, and home of the Surrey Delta Métis Association. Joining me today are people who share my dedication to strengthening healthcare and housing in BC. Speaking today, I'll just give you the run of show. Our Premier David Eby, who we'll hear from shortly, Dr. Baldev Sanhera, Victoria Holt, an occupational therapist at Surrey Memorial Hospital, and Scott Wheatley, the Executive Director of the Cloverdale District Chamber of Commerce. I'm also joined by colleagues in the legislature, including the Minister of Housing, who has a big part in what we're doing today, Ravi Kahlon. My colleague Mike Starchuk from Surrey Cloverdale, of course, is here. My colleague Ginny Sims from Surrey Panorama Ridge, the CEO and President of the Fraser Health Authority, Dr. Victoria Lee is here, the Chair of Fraser Health, Jim Sinclair is here, and many more, especially healthcare workers who are joining us today to talk about the significant actions and to reflect on the significant actions we've taken to improve healthcare in our province. A few weeks ago, we gave a progress report on here at the Second Surrey Hospital of the hundreds of construction workers working today on site to build a second hospital right here in Cloverdale. And today we're here for another exciting announcement. And to lead that off, please welcome Premier David Eby.
Thanks very much, everybody. Good to see you. Really good news day today here in the beautiful city of Surrey and in Cloverdale. Thank you for joining us. This site where we're standing is certainly a hospital construction site. But when the construction is done, we need the amazing healthcare workers to staff that site. And part of our recruitment and retention challenge around healthcare that many employers face across the province is the reality faced by many British Columbians. They have trouble finding a decent place that they can afford, either to rent or to buy. And that's why it's such good news to be here on the site of what will be a BC Builds housing project for healthcare workers. I'm excited too. This is a site where we're using publicly owned land, health authority land, to build housing for healthcare workers to support in the recruitment and retention of healthcare workers at the beautiful new Surrey Hospital. We're doing this kind of work with school boards, with city governments, and with other public landowners to ensure that workers can find the homes that they need. It's not the main part of the announcement today, but I'm just really glad to be here. I want to recognize our Housing Minister, Ravi Kahlon, for his team's work on this, and local MLA Mike Starchuk, who really underlined the importance of making sure not just that the hospitals here in Cloverdale, but also critically needed housing for healthcare workers. I don't think it's any secret, and certainly it's front of mind for many British Columbians, the challenge that we face around healthcare in British Columbia. It's not a unique challenge to BC. This is a challenge faced across Canada. It was and remains the top topic of conversation when all the premiers get together across Canada. And the big difference is how we're tackling this issue and how we're really going after it in the province by recruiting and retaining and recognizing the credentials of internationally trained health professionals, as well as training up the next generation of healthcare workers. There are two potential approaches that are on the table as we move out of government into a discussion about this through the election period. Our proposal is that we continue doing this important work to invest in and expand our healthcare system to train up the workers that we need. But we have seen another model in the past. Previously, when John Rustad was in government, his government promised, and they were then labeled the BC Liberals, they promised that they were going to build a second hospital here in Surrey. But instead of doing that, once they got elected, they actually closed hospitals. They sold the land for the Surrey Hospital, as well as 20 other properties in the city of Surrey that could have been used for schools and housing. They cut healthcare worker jobs. They cut healthcare worker funding. Fraser Health proposed in 2010 medical school for the city of Surrey. John Rustad and his colleagues said no. In addition, though, they made further promises. In 2010, they said, we're going to make sure that every British Columbian has a family doctor. They called it the GP for Me program. And they said by 2015, every British Columbian will have a family doctor. Well, the years ticked by, and by 2015, 135,000 fewer British Columbians had a family doctor than had a family doctor when they started the program. All this happened because they made the decision to prioritize tax cuts for the top 2% of British Columbians over the needs of everyday British Columbians. And astonishingly, John Rustad has made similar announcements. That's his intention again. Just yesterday, he announced his intention to cut taxes for the biggest polluting companies in our province, which happen to be some of the most profitable companies, oil and gas companies. So he wants to cut taxes for oil and gas companies and to pay for it with a $4 billion cut to our healthcare system. That's his healthcare plan. We can't afford that risk. And some of the cuts that he's talking about are revealed again today. He was on Red FM, and he talked about the need to do a review of this hospital project. Have a look behind me. There's 250 workers on that site. Hospital construction is well underway. And the suggestion of doing a review means some very simple things. One is all of those workers go home and construction stops. The second is the people of Surrey are denied the second emergency room that they so desperately needed the last time John Rustad was in government when he sold the land. He's going to do it again. We cannot afford that risk. We can't cut healthcare when we need to expand it. We've got to support British Columbians with the healthcare that they deserve. We said yes to the second hospital in Surrey, standing here, a second emergency room, cancer care center. We're delivering that for the people of Surrey right here in Cloverdale. We said yes to a new medical school in Surrey. It's taking students in September. And we're hiring thousands of new healthcare professionals across the province to deliver the care we need. We have 800 new family doctors in British Columbia. So for today's announcement, I'm here to share with you some of the results. And we know we've got more work to do, but I want to share with British Columbians that we are on the right path to addressing healthcare for everybody in this province. Our government is proud to share that we have connected 248,500 people to a family doctor or nurse practitioner in the last 12 months in the province of British Columbia. We've got hundreds of more people getting matched every single day, 4,000 a week. And our projections are that over the next 6 months, we'll be connecting a further 250,000 British Columbians to a family doctor or a nurse practitioner. Right now, we're seeing 588 people matched every day to a family doctor. And since 2018, 500,000 British Columbians have a family doctor who didn't have a family doctor before. And I want to thank everybody whose work contributed to that result. Our government is making choices to strengthen healthcare in British Columbia, to make sure people have access to the healthcare that they need, that they deserve, which includes access to a family doctor and nurse practitioner. We're upgrading or building at 30 different hospitals across the province of British Columbia. We're taking action to cut wait times. We have the second lowest wait time of any province in Canada for hip and knee surgeries. We know there's still so much more to do to build out our healthcare system, but I can guarantee you we won't get to where we need to get by cutting. We have to build and train and ensure we're protecting our public healthcare system for all British Columbians going forward. We won't stop until the job's done. Thanks very much.
Thank you, Premier Eby. Today's announcement, the announcement of attachment to family doctors, the announcements around the investments, particularly here in healthcare in Surrey and province-wide, are significant. Since 2018, we've been transforming primary care in BC, introducing team-based care and connecting more people to family physicians and nurse practitioners, as Premier Eby just outlined. And we're actively recruiting new healthcare workers. Today's announcement ensuring housing for healthcare workforce here in Cloverdale, we'll all benefit from, and it's part of a multifaceted approach to improving BC's healthcare system. To speak about what today's announcements mean for healthcare professionals, please welcome Dr. Sanhera to the podium.
Hi everyone, I'm Dr. Baldev Sanhera. I'm a family physician from the Fraser Health Region, specifically Burnaby. And I thank Minister Dix and Premier Eby for continuing to work on improving the healthcare system for all of us, especially the staff that works within the healthcare system and the patients that are also receiving care. One of the biggest things that I can say has helped us in primary care as family physicians has been the development of the longitudinal family practice payment model system. We've moved away from fee-for-service, which is delivering piece-by-piece care to people, to a more holistic payment for time and encounters, which allows family physicians like myself to provide better longitudinal care to our patients over the long term. So when a person comes to me with complex needs, if they are elderly and they've got multiple medical conditions that they need care for and it takes time, I'm not worried about seeing them in a short 10-minute appointment. I can spend the time that that person needs. Somebody comes in with other complex needs such as mental health. I have the ability to then support that with my expertise, but also we've developed prime care networks throughout BC. There are many in every district, in every jurisdiction, and we're able to then partner with our other care providers like social workers and mental health workers, clinical workers, that are able to then support the patient's whole needs that they have, right? And so it's been a very efficient way to get care to people. And I love the fact that more and more people are getting attached to family physicians. Family physicians are providing primary care, which is our foundation of our healthcare system. If we have a strong primary care system, everything else can build from that. And so it's wonderful to see, up to 500,000 people that have been attached recently, getting that extra bit of attention that they need. Have we fixed everything in healthcare? No, but we're on our way. And I'm sure that with everybody here working collaboratively together, that we'll be able to come up with even better solutions so that the only thing that matters, which is patient outcomes, is first and foremost. Thank you.
Thank you. Thank you very much, Dr. Sanhera. Thank you for really the extraordinary work of people in Burnaby with the primary care network there, the urgent and primary care centers there, and the impact of the LFP model that Dr. Sanhera has been an important advocate for in BC for a long time, changing the way we deal with primary care to put patients first. Of course, the workers who make up our healthcare teams are a diverse group, providing diagnostic, administrative support services, and many other things. To speak of the needs of allied health professionals, it's my honor to invite Victoria Holt to the podium. Victoria?
Good morning. As an occupational therapist who serves on the front line of healthcare in BC, I am honoured to be invited here today for this announcement, specifically in respect to workforce housing, which is a very welcomed initiative in supporting those of us who dedicate our lives to caring for others. The announcement of new housing for healthcare workers adjacent to the new Surrey Hospital and BC Cancer Centre could be a game changer for many in this field. Like with so many other Canadians, especially in the Lower Mainland, finding affordable housing close to work can be a challenge for some healthcare workers. This project directly helps to address that need, and I hope it is a model that can be adopted and expanded throughout the region and BC. Having to worry less about housing options and reducing commute times means healthcare workers can spend more time doing what we love, caring for our patients, without the added stress of long and tiring journeys to and from work. It also means having more quality time with our families and friends, and maybe financial relief, which is essential for mental and emotional well-being. Attainable living close to our workplace can also foster a sense of community. It allows more opportunities to support one another, share experiences, and build strong relationships with our colleagues. This sense of belonging is important for morale and job satisfaction. Importantly, I see this housing initiative as a powerful tool for job retention and attraction. Knowing that our employer and the province are committed to supporting healthcare workers helps make us as professionals feel valued and appreciated. It sends a clear message that our well-being is a priority, which in turn can make us more dedicated to our roles. It will encourage us to want to work here, settle here, and establish roots in this community. Support for healthcare workers is essential. Like in my line of work, we saw 8 new full-time positions granted to occupational therapy this year. This project further demonstrates that the provincial government, BC Housing and Fraser Health genuinely care about the people who make up our healthcare system. This is a testament to their commitment to strengthening supports both on and off the job. More than just a building project, I believe this housing initiative is an opportunity to enhance the quality of life for many healthcare workers, making it easier for them to continue providing the best possible care to their patients. Your support is important to everyone working on the front lines in healthcare in BC. Thank you to everyone involved in making this a reality.
Thank you very much, Victoria. And of course, we're here on the site of the new Surrey Hospital's BC Builds housing project that Minister Kahlon and his team at BC Builds have been so involved with Fraser Health, and to speak about what investing in housing means. And of course, in our new hospital here, it's my honor to welcome Scott Wheatley.
Great. Thank you very much, Minister Dix. The new Cloverdale Hospital, and it is the Cloverdale Hospital, just for the record, represents real opportunity for our community. From it grows new business opportunities and a more vibrant community. The first major obstacle of many businesses in the area, and this hospital will be no different, is affordable housing nearby. Many Surrey workers are faced with multiple hour commutes daily. Priority housing for hospital staff will allow the hospital to recruit the best and the brightest for our new facility. Surrey, poised to become BC's biggest city by population, desperately needs this facility. And like any family touched by cancer in BC, I realize that the value of the BC Cancer Centre is immeasurable. The Canada Mortgage and Housing Corp estimates that BC needs to build an additional 610,000 new homes above the current trends by 2030 to alleviate the housing shortage in our province. This project is a logical step in reducing that need by focusing on the needs of healthcare workers. We also remove potential recruitment obstacles. It is the healthcare workers who will be the heart of the hospital. The jobs created during the development of this building will provide high-paying jobs who all support local businesses. Throughout the area, demand for housing is high. Cloverdale is experiencing a mini boom with many new housing projects. As the Surrey-Langley SkyTrain nears completion, we will experience an explosion of development in North Cloverdale and Clayton. All of this development starts with a fully functional hospital, staffed by our neighbors living in our neighborhood. Thank you very much.
Thank you, Scott. That's Cloverdale Hospital. I got it? Okay. I got that. The new Cloverdale Hospital here, the really first of its kind workplace-based housing right here at the new Cloverdale Hospital, a new tower at Surrey Memorial Hospital, a new SFU medical school, 2 new urgent and primary care centers here in Cloverdale, a new nurse practitioner-led clinic, and very importantly, 476 net new healthcare workers at Surrey Memorial Hospital, 476. So I came here in June to meet with healthcare workers. You see 835 net new family doctors taking patients in British Columbia. As the Premier has said, more than 500,000 people attached through primary care networks, through the Health Connect registry, through new to practice contracts in BC. And really, I would say across the board, a commitment to train more, to support healthcare workers more, to recruit more, to bring in more internationally educated healthcare workers. That is our commitment. We can continue down this road of making progress. of attaching British Columbians to a family doctor, or we can take another road to cut that progress, to cut it short and to go back. And I'm very proud of these initiatives, of course. We've got much, much, much more to do, and I know that the government is determined to do it. And with that, we're going to hand it over for questions and bring Premier Eby back to the podium.
Thank you for joining us today. We have members of the media here in person as well as those on the phone line. For those on the phone line, please press star 1 to enter the queue. All members of the media will be limited to one question and one follow-up. We're going to begin today with Reagan Hasagawa from CTV News. Go ahead, Reagan.
Good afternoon. I just wanted to get your reaction to a new Research Co. poll out today showing the BC NDP with a narrow 2-point lead over the BC Conservatives among decided voters.
Sure. Well, I know we're getting into the campaign period. There's going to be lots of polls between now and Election Day. And the core for me is going to stay focused on what British Columbians need, on how we can support them. I know there was a lot of speculation when a backroom deal was reached between Kevin Falcon and John Rustad, a deal that it turns out stranded 20 of their staff without any kind of severance, people who worked with them for decades. They left those people behind. They're going to leave behind British Columbians as well if they ever get the chance to govern. But that backroom deal, people thought, okay, well, that means that all the BC United voters are going to go over to the Conservatives. Well, what we're seeing is BC United voters, BC Liberal voters that can't stomach the idea of voting for someone who cut $4 billion from the healthcare system, who's a climate change denier, who thinks that the whole thing is a lie and a hoax, who courts and actively engages with conspiracy theorists and a white nationalist as his candidates. They won't put up with it. Those are not the values of British Columbians. And I say to all those people who have never voted NDP before, that it's just not something they've done provincially in our province, to have another look at us, because what John Rustad and the Conservatives are proposing is a real departure in terms of prioritizing the services people need, but also the values that we all believe in as British Columbians, where we value science, vaccines, climate change action, and a strong province where we all work together.
Reagan, do you have a follow-up question?
I do. This one's for Minister Dix. Minister, given the letter from emergency doctors at Surrey Memorial that was released yesterday, is there any contemplation about a change in Fraser Health leadership?
Well, a couple of things. First of all, at Surrey Memorial Hospital, we are making very significant progress. All of that progress was based in consultation with the staff at Surrey Memorial Hospital. I said in my comments in the announcement, 476 net new staff at Surrey Memorial Hospital in the hospital. Net new in the last year, 43 new doctors, net new. Since January 2023, 108 new doctors who hadn't worked there before recruited. Emergency room doctors at Surrey Memorial Hospital share my commitment to recruitment and the continuing need to recruit at the hospital. They've made a proposal, the doctors of BC, around the way emergency room doctors are compensated. They made that proposal on September 5th. We've had a meeting with the doctors of BC. We hope to meet with the doctors later this week to discuss those issues because, like them, I strongly believe that we need to continue to recruit to Surrey Memorial Hospital, to its emergency room, to support emergency room staff, because you see at Surrey Memorial's emergency room just how many patients are coming every day. And so, yes, we're building this second emergency room. Yes, we built and rebuilt the emergency room at Langley Memorial Hospital and at Peace Arch, but at Surrey Memorial Hospital, including building the new tower, we've broken ground on the new renal center, the new cardiac catheterization lab, which are specialty services. We got to work with our emergency room docs to recruit more emergency room doctors to make services better in the emergency room at Surrey Memorial Hospital. We've made a number of the changes that they've requested, and we're going to continue to work with them.
Our next question will come from Benoit Ferradini from Radio-Canada. Go ahead, Benoit.
Question for Premier Eby. Hi. With the growing population in Surrey, maybe 1 million residents by 2040, even with 2 hospitals, critics say you won't have enough to serve the population. What's your take on it?
Well, there's no question for the people of Surrey who have seen their city grow without investment for the basic services that every other big city has seen in our province and deserves to see. Things like schools, hospitals, transit. Under the previous government, Surrey consistently got bypassed. The last 4 years, John Rustad sat around the cabinet table, not one new school, not one, in the entire city of Surrey. The land for the hospital sold instead of being built on. The Surrey-Langley SkyTrain project promised and promised and promised again, never funded, never started, never built. Building the hospital, building the schools, building the transit system so people can get around. The largest capital investments the city of Surrey has ever seen, the largest in the history of the province. And that is in addition to our recent commitment around the Surrey Memorial Hospital of an additional patient care tower, in addition to the renal center, the cardiac catheterization lab, and so many other improvements at that existing hospital site. We know we've got a lot of catch-up work to do in Surrey. Surrey's been neglected for a generation on so many fronts. And we can ask the question, why? Why did John Rustad feel that Surrey was less worthy of the kind of investments that other cities saw? But what I can tell you is that we're fixing that. We're making sure the people of Surrey get the investment and the services that they deserve, which are long overdue.
Our next question, we're going to go to the phone lines with Richard Sussman from Global News. Go ahead, Richard.
Premier, for you, I'm sure you've seen the changes announced by Meta today. Are you satisfied that these changes around teen settings will satisfy the concerns you had around Meta and the impact that they are having on young people in this province?
Thanks, Richard. People will remember our work recently in the last year or so, raising concerns following the horrific death of Carson Cleland and Prince George. He was a family, a loving family, an amazing kid, helpful to neighbors, just like an incredible guy, and had one interaction on Snapchat with a predator that didn't live anywhere near him, lived thousands and thousands and thousands of kilometers away in another country. We tricked him into sending pictures of himself and caused him to believe that he would be subject to so much personal embarrassment that it caused Carson to take his own life. It's horrific and totally preventable. Totally preventable. There is not a place in British Columbia where children are present, where the operator is allowed to just welcome in anybody who comes in, to ask children for pictures of themselves, to solicit those pictures, to contact them in the absence of their parents' consent, and to threaten those children. It just is not permitted. It is illegal. And there is nothing special about these apps, that they shouldn't be held to the exact same standard as any operator of any playground or children's amusement park or anything else. And so we forced those groups to the table with the threat of legislation that would subject them to significant potential damages for their negligence, that are incurring costs on BC taxpayers through new anorexia supports for kids with distorted body images because of what they're seeing on these things. The impact on kids' mental health around depression and anxiety, as they feel they can't keep up with their peers or they're being bullied through online services. This is allowed to continue. Extreme stunt injuries. I could go on. And so I would say that this is the minimum of what we would expect, not just from Facebook and Meta and Insta, but from Snap, from all of the competitors. We've actually presented them with a declaration of what we expect them to do for the kids in BC to keep them safe online. We banned cell phones in schools to keep them safe at school, but for at home, for overwhelmed parents, the kids are using multiple apps, trying to figure out all the settings and how this all works and what you're supposed to do to keep your kids safe online. Is this one that allows predators to contact or not? We need a consistent standard for BC kids to keep them safe online. And that is our goal for all of these companies.
And Richard, do you have a follow-up question?
Premier, Minister Dix went through the things that you are doing at Surrey Memorial, yet still the doctors there are saying this is not tenable. They are under pressure like they've never experienced before. Premier, what should give people confidence that you are going in the right direction, considering these concerns that continue to be raised by those working on the front line?
Thanks, Richard. The challenges around healthcare, the pressures on emergency rooms, the pressures on healthcare staff are present across Canada and in many parts of the world right now. The difference is here in British Columbia is the work we're doing to address those pressures. You can see over my shoulder, one of our key responses to take pressure off of the emergency room in Surrey Memorial Hospital, building that second emergency room, not putting it on hold and doing a review and deciding whether or not we want to build it, or maybe Cloverdale is not the right location, or whatever it is the Conservatives are saying. We're building that second emergency room. And today announcing the connection of hundreds of thousands of British Columbians to family doctors, and more to come, which takes pressure off of emergency rooms because people get the care they need sooner, preventing them from ending up in an emergency situation headed to an emergency room. We have big challenges, there's no question. The biggest challenge is around the recruitment and retention of healthcare workers. With more than 100 new doctors at Surrey Memorial Hospital, I know we're headed in the right direction, and I also know those emergency room doctors are under huge pressure. There are significant demands. Surrey is growing so quickly. We added 300,000 people to our healthcare plan over the last 2 years in this province. All of those people need care, including in emergency rooms, and a lot of those folks located south of the Fraser, and particularly in Surrey. Surrey is the epicenter of that population growth. So they're feeling all of that pressure. We're going to stand with them. We're going to provide them with the support they need. But I guarantee you, we will not be able to address this issue by cutting the healthcare system, as John Rustad is proposing, by putting this construction site on pause to do a review and delaying and sending all the workers home and driving up costs and uncertainty. That's not going to solve the problems that we face.
Our next question will come from Alec Lazenby from Vancouver Sun. Go ahead, Alec.
Hi, Premier. I just wanted to ask, we hear about these numbers, we hear about the number of new doctors being added to the hospital, the new emergency room, and yet we have this letter that's coming out from doctors saying that 10-hour rule, the number of patients being admitted within that time frame is still under 20%. Staffing, the number of shifts being added is still only 8% when admissions have grown 30%. When can we start expecting to see actual results and changes to how strained these healthcare workers are at the hospital?
Thanks, Alec.
Yeah, thanks, Alec. I think what we have to do is, and what we're doing is continuing to recruit. I met with emergency room doctors, with cardiac doctors, with all doctors really at Surrey Memorial Hospital last year, but also nurses and healthcare workers. And what we've done since then is added net new 476 positions. Now, the population of Surrey is increasing dramatically, and the pressure on the emergency room is significant. With respect to emergency room doctors, we have made changes in a number of communities about the way we've paid doctors. In Surrey, in the emergency room, we have a fee-for-service model. And Surrey doctors have made some proposals around that, some specific proposals that they believe would help with recruitment. And we'll, of course, look at those because we're doing everything we can everywhere to recruit more doctors and nurses and healthcare professionals in general. And you see the results across the province in terms of primary care, and you see the results in terms of the number of people working in Surrey. But it's a challenge. The Premier talked about the population numbers, 187,000 more people to MSP in 2023-24, 178,000 in 22-23. That's significant in terms of the demands it place, and the epicenter of that, as the Premier said, is Surrey. So we've got to continue to work with our healthcare workers to do what we've been doing, which is adding doctors, adding nurses, adding healthcare professionals, adding internists, adding long-term care, which we're doing in Surrey as well, to address these issues and to continue to move forward. I don't think anybody would suggest that we are not better off by the addition of 476 net new staff to Surrey Memorial Hospital, or that we should cut that back, that that's the path to make it better. But that's precisely what John Rustad is saying.
Alec, do you have a follow-up question?
Yes, I do, and this one is for the Premier. We've seen multiple instances of people being reprimanded for speaking out, talking about the firefighter here in Victoria, talking about long-term care worker in Nanaimo. And doctors at Surrey Memorial have talked about how they don't feel comfortable putting their name to a document like this or speaking out about the specific circumstances that they're facing. What changes? You said people should be able to speak out and send you letters about what's going on. What changes are going to be made to actually make people feel like they can speak out and not be reprimanded, especially when it's within a healthcare setting?
Yeah, thanks, Alec. It's vital that when people on the front lines have concerns that they want to bring forward, that they're able to bring them forward, and in particular, that if they want to get that concern to me, that they can do it. So that firefighter in Victoria, worked with him and his team to make sure that it's clear to the decision makers who are reviewing the one-day suspension that he faced that this was incredibly helpful to me to be contacted by this firefighter, provide this information. For the healthcare worker in Nanaimo who's anxious about being disciplined, I understand from a reporter, she told me that person feels that way. Shouldn't be the case. In fact, we brought in whistleblower laws to protect workers who bring forward information. We'll have a look at those laws and make sure that they're fulfilling the requirements. We'll work with healthcare workers to make sure that they're protected by them. But it is vital that they're able to bring that information forward so we can address issues in the healthcare system and everywhere else in the province.
Our next question will come from Laurel Collins from Black Press. Go ahead, Lauren. Lauren, are you with us? We'll come back.
Can you hear me now?
You can?
Go ahead.
Yeah, we can.
Oh, okay, perfect. My question is related to the housing announcement. How many units is this BC Builds project next to the hospital going to be, and when is it set to open?
Okay, I'm going to go out to the bullpen and call in a relief pitcher here. The housing minister is here.
Thanks, Katie. As with most of our BC housing projects, we post the site onto our website. Home builders bid. They come back to us with proposals on what they think they can get done, what the design may look like, and then we choose them. When we started BC Builds earlier this year, we already have projects that have shovels in the ground. Whistler construction is underway. Cowshan construction is underway. The projects in Langley, the proponents have already been selected within 3 months, and those proponents are starting construction soon. And again, this is exciting because we're able to build housing targeting healthcare workers, because we've heard from healthcare workers that it's great. They want to come here, they want employment, but if they can't afford to live nearby and they can't afford housing, it's really hard to be part of the solution. So this is the start. I suspect we're going to see this type of housing for healthcare workers across the province as we move forward.
And Lauren, do you have a follow-up question?
And then I do, yes. So how many units are you hoping for, or homes for healthcare workers at this site?
Yeah, we're hoping for hundreds of units here on this site. The site is quite big. We also have other sites that we're working on right now that will be able to do similar things in Surrey, in the interior, on the island. But yeah, hundreds of homes will be available here. And again, we'll see when the proponents come forward with what the designs will look like and what they think they can get on the site. But those details will come once the bidders put their bids in.
Our next question will come from Amelia John from CBC News. Go ahead, Amelia.
Thank you so much. My question is for Minister Dix. It relates to breast cancer screening. Every 2 years, women of a certain age get a mammogram, but for those with dense breasts, they apparently qualify for an ultrasound screening in between those mammogram years. The problem is it's virtually impossible to actually book an appointment. There's one clinic in Vancouver that's doing this, but they're fully booked and they're not accepting new patients. Now, if patients want to do this, they'll have to pay $700 to go private. We talked to this doctor at the clinic. She says there's really no proper MSP fee schedule in place for ultrasound screenings, no incentives for doctors to actually do this. She went on to say that she actually praised British Columbia. Your government said back in 2018 we were really leading the way in Canada when it came to screenings for women with dense breasts. And my question for you, Minister, is When will there be a practical fee schedule so doctors will be more willing to do ultrasound screenings? And what was the point if people can't get appointments? What was the point of making that announcement back in 2018?
Oh, I think on the second point, it was absolutely empowering to women. And we were the first jurisdiction in the country to make that information available. It was the result of powerful advocacy by women at the time, including by Dr. Paula Gordon and others. And it's an important initiative that women have the power of knowing that information and being able to act on it. I agree with you, and that's why we've seen an increase in diagnostic screening, breast diagnostic screening in the past year, and significantly in terms of numbers, that we have to expand out that access. And we're happy to look at issues around fee codes to make sure that doctors have the right incentives, but it's critically important, especially for women with dense breasts, who sometimes are more vulnerable or more susceptible to breast cancer because the screening doesn't provide the appropriate information all the time. So that's why we made the information available. It was an important innovation. I was proud of it at the time, and we've got to continue to build on that in BC. We're still leading the country in this area, and we've got to continue to do so. Some provinces have joined us, but the point of it is to empower women.
And Amelia, do you have a follow-up question?
Thank you so much. My follow-up question is for Premier Eby. It's from my colleague Chad Pawson. Chad wants to know, Premier, will you deliver a detailed plan during the election campaign on how to deliver a new funding model for TransLink?
Well, there's no question that British Columbians need access to transit, and it's not just in the TransLink area, it's BC Transit as well. It's right across the province. Our platform will include specific commitments around transit support, just like we've done since we were elected in 2017. You know, we took over from a government that didn't prioritize transit. It just didn't. And it doesn't matter whether it was investments around rapid transit in the region, rapid bus, overcrowded buses, and so on. And then we had the pandemic. During the pandemic, we provided $1 billion directly to TransLink so that they were able to continue operations and ensure that once public health controls loosened, people could get to where they needed to get. We had the fastest recovering transit system in TransLink of any transit system in North America based on ridership. I'm proud of that. We're a transit government. We're building transit on the Highway 1 expansion that should have been built a generation ago by John Rustad. It was put off and put off and put off. We're building it. For people who have to drive, they don't have a transit option. But on the shoulders, we're putting bus on shoulder transit lanes so that people in the valley have access to fast, effective, and efficient transit. We're going to keep doing that work. It'll be part of our platform. I'm looking forward to it. We can't afford to cut now. You know, people are going to sit in traffic wondering, or they're going to sit on a street corner waiting for a bus that's not going to come if we cut transit funding right now, which is exactly what the Conservatives are proposing.
We have time for one more question. We're going to go to Mark Page from BC Today. Go ahead, Mark.
Thank you for taking the question. How many people, you talked about, all of the number of people that are being connected to a primary care doctor. How many people are left on the waiting list right now for a family care doctor?
Thanks. Before I pass it over to the health minister, I just wanted to provide a little background. It's a bit inside baseball to extend the metaphor about the relief pitcher, but we have this Health Connect registry now that enables British Columbians that are looking for a family doctor to register, and I really encourage everybody that's looking for a family doctor to register. By having this registry combined with our new agreement with family doctors, where we know specifically British Columbians that are connected to individual family doctors, we're able to say with certainty about the number of people we've connected to family doctors to ensure that the programs we've set up assist family doctors in connecting directly to patients the way that they should be, and to know what the demand is for additional family doctors. Now, my understanding is there's somewhere in the neighborhood of 300,000 people on the Health Connect registry that still need a family doctor. We are on track to add and connect 250,000 more British Columbians the next 6 months to a family doctor or nurse practitioner, which would bring us through a significant part of that list. But it's certain that there are many, many more British Columbians, hundreds of thousands, who are not on the list. And we do encourage people to register because that is the fastest way to get connected to a family doctor. Let me just see if the health minister has.
Just specifically, just a couple numbers for you that might assist in the work you're doing. The Premier's correct. There are between 300,000 and 400,000 people on the Health Connect registry who still need a family doctor. Currently, there are about 313,000 spaces, meaning family doctors who have people to add to their patient panels, or alternatively new to practice doctors who are building out their patient panel. That's with current doctors, and we are adding new doctors every day. So those are real opportunities, and those 313,000 spaces are why it's so important for people to connect to the Health Connect registry. In general, the issue of how many people are without a family doctor is an issue that's addressed in the Canadian Community Health Survey. But our focus, which is seeing a reduction number of people needing a family doctor last year, which is good news. But our focus is on getting people family doctors, and this 500 plus thousand people who have got a family doctor, the 313,000 people who have an opportunity to get a family doctor in the next period, where those opportunities are available right now. Those are real opportunities from British Columbia, and we're focusing on attaching people to family doctors and improving care, as well as to team-based care and to nurse practitioners.
And Mark, do you have a follow-up question?
Yeah, within those numbers, how many people have been, like myself actually, been waiting more than 2 years to get a family doctor? And is there a goal for wait times? And if there is a goal, what is it, and when does the government expect to achieve that goal?
Yeah, Mark, our goal is that once people register on the Health Connect registry, that they connect with a family doctor as quickly as possible, ideally immediately. That's our goal, is that there's no wait list. You come in, you connect, you're done. I think that goal, well, it's been articulated a few times by different governments, most recently in 2010 with the GP for Me program, has felt completely out of reach. When you announce in 2010 everyone's going to have a GP, and then 5 years later 135,000 fewer people have a family doctor, you'll get a sense of hopelessness about this. What's different this time is, for the first time in more than 20 years, fewer British Columbians are looking for a family doctor than the year previous. We're moving in the right direction. And not only are we moving in the right direction, with almost 250,000 people with a family doctor over the last 12 months, it's accelerating. We're expecting to match about the same number again in the next 6 months as those spaces that the health minister talked about come online. So I really encourage people to get registered through the Health Connect registry, even if they've been waiting for a long time. We're making progress on this issue. We're connecting more and more British Columbians, and absolutely not to give up hope, because we're turning the corner on this issue. And if you're not registered in the Health Connect registry, it does make it a little bit more difficult for us to get you connected to that family doctor and that nurse practitioner when they come available. So in terms of overall wait times, Adrian, do you have any?
Just say it's the Health Connect registry was extended to all British Columbians on July 1st, 2023. And I think we're making progress, and it's really a contrast. The significant number of people who have been attached to a family doctor because of what Dr. Sanhera talked about, primary care networks. There are 79 primary care networks in BC. Just to compare that, in 2010, the previous government announced there were going to be primary care networks in British Columbia everywhere. They did 0. In 2010, they announced GP for Me. They abandoned GP for Me in 2015 with more people needing a family doctor than before. This is the work we need to do. Attaching to a family doctor means a patient developing a relationship with a doctor and attaching. It does take time. But when you're adding family doctors, 834, when you're attaching more people to family doctors, we need to keep going on that, take up that opportunity forward. We can't cut it now, and we can't give it back to people who talked about doing it and absolutely, utterly, comprehensively failed.
And that's all the time we have today. Thank you for joining us, everyone.